Welcome to Victor's Children, a podcast from so-called Canada talking socialism from below. My name is David Canfield. I live with my partner and cat in Winnipeg, Manitoba, which is in Treaty 1 territory, the traditional territory of Anishinaabe, Cree, Ojibwe, Dakota, and Dene peoples, and the homeland of the Métis Nation. All those of us in the Canadian state who aren't Indigenous need to commit ourselves to the struggle against settler colonialism. Victor's Children is a member of the Harbinger Media Network, a community working to promote left podcasts in Canada. Check out the list of Harbinger podcasts at harbingermedianetwork.com. It's been over 4 years since the SARS-CoV-2 virus began circulating around the world, causing death and illness on a massive scale and sparking unprecedented responses from states. Today, most people live as if COVID-19 doesn't matter anymore. Huge numbers of people have been infected, some more than once. A large majority of the world's population has had at least one vaccine dose. On the other hand, only a tiny percentage of people globally have recently had a vaccine tailored to the variants of the virus currently circulating. Even in Canada, which is an advanced capitalist country where vaccine access is better than in most places, even if it's not nearly good enough, less than 20% of people are up to date with their vaccinations at the moment. Much as I think many of us would prefer not to have to think about it, after all, there's so many things for us to be concerned with, I think the kind of COVID is over attitude that is so common these days is a political problem. So to discuss the health effects and politics of COVID-19 today, I'm joined on this episode of Victor's Children by Sam Friedman. So Sam, could you introduce yourself to listeners and just briefly explain your expertise related to COVID-19? And that's a question I ask because, of course, there are so many claims that get made about expertise and knowledge around this particular issue.
Yeah, I'm not going to claim to be a virologist or anything like that. I mean, or an immunologist or a physician. I am a socialist, activist, trained sociologist who blundered into AIDS research in 1983. And in the process of doing that research, learned an awful lot about viruses and how they spread through communities and what they do, and also about the politics of AIDS and of activism around AIDS of various kinds. So that, and I was involved in a lot of that. So when COVID came, I made the decision not to try to really become an expert epidemiologist. I felt, I've been doing this stuff for 40 years, just almost 40 years, and let the younger people do it. But about a year into the pandemic, I began to realize that politically all sorts of crazy stuff was being said on the left as well as elsewhere. And so I started reading more and writing some articles. I've published a number of articles that deal in one way or another with COVID and about COVID politics, some of which approach it from a Marxist perspective, some of which are approaching it from a more public healthy, normal, kind of radical public healthy, but just honest public healthy kind of perspective. Like I was a co-author on a piece which really discussed how the U.S. Centers for Disease Control not merely had screwed up the beginning of the pandemic, but was rushing to say the pandemic was over prematurely and destroying its data systems so as to make that appear to be true and giving bad advice. So, I've got a certain amount of expertise. There are others who are more knowledgeable. But I certainly can talk on it, I think, at a useful level.
And I'll certainly include in the show notes a link to a couple of those pieces that you have written around COVID-19. So let's start just with a kind of refresher for some people, and perhaps it will be newer for others, with a little bit of discussion about the impact of this disease on people who become infected, because there's an idea out there that among a lot of people that this is really just like influenza or a trivial virus, at least for people who are vaccinated. But in April 2024, a letter from the U.S. left-wing health group, the People Center for Disease Control, which I've also linked in the show notes, says that, quote, COVID is a systemic disease with harmful impacts, acute infections and long COVID, that are greater than influenza and RSV. So could you unpack that a little bit for us and talk about the impact of this disease on people who are vaccinated, people who are not vaccinated, and people who may have been vaccinated but are not up to date with their vaccinations? Just some of those kinds of issues.
Sure. First, I have to apologize for not knowing the Canadian statistics. But in the U.S., the current estimate, and it's a minimum estimate, is that 1.2 million people have died. And that's out of a population of roughly 300 million or whatever it is. So it tends to be concentrated, the deaths, among certain groups of people. Old people like me. I mean, I'm somewhat of a sitting duck if I get infected. Minority people, members of various oppressed groupings like the indigenous populations or First Nations, Black people, most groups of Latinos in the United States, poor people, workers in a number of specific occupations, not just the hospital workers, but meat packers, agricultural field workers, they tend to get infected most and they tend to die the most. Now, vaccines help. All the studies I've seen that compare vaccinated people to unvaccinated people say that you're less likely to get hospitalized, you're less likely to die, and considerable evidence that you're less likely to get long COVID. Having said that, less likely does not mean that you're not going to. But we've been blessed in that COVID, compared to some other infections, even as it's worse, would kill fewer people compared to what the great influenza epidemic of roughly 1918 to 2021. It's got a fatality rate considerably lower than that. A huge amount lower than HIV before the medications became available. But not as bad as current. Much better. That is, you're more likely to survive than current influenzas, for example. So that the comparison with influenza is just the current variants is COVID is much worse. Now, the vaccine gives you some protection against long COVID, but research on long COVID is still relatively new. So, I can't give any precise figures. In any case, I might not be qualified to. But it is protective. Now, if you've been vaccinated, you can still get long COVID. If you've been vaccinated, even if you're completely up to date, bad things can happen to you. But the odds are much lower. And if every additional time you get infected makes it that much more likely that you're going to get long COVID. Long COVID can be anything for a few months to the rest of your life, we think. And, I know some people who have been debilitated by it for years, and they get very, very tired very easily. Some people can barely make it out of bed in the morning. Others, can be modestly functional. That's why there are long COVID organizations that are actually doing some good work, because some of the people can function, at least some of the time.
Yeah, I think that point about the effect of having, multiple infections is one thing that's an emerging finding from research that's not had much public attention. And that, if there's anything else you would like to say about that, I do think that it's.
It's simply a reality, and there's a lot we don't know. COVID keeps changing. One of the basic dialectical understandings about viruses is they're a moving target. When you talk about a variant, at some point a variant becomes, could be classified as a new virus. It's got differences from the previous ones, and my reading of the evidence, which is not deep reading, is that the virus has been evolving in ways that make it more transmissible, which means you're more likely to get infected. There's some reason to think it may be less fatal, though we can't be sure if that's because of prior immunity from either having had it before or vaccination, which is only a partial immunity. But it's going to keep mutating, and there's so much of it around in the world that we have to expect it's going to keep mutating. I mean, any efforts, had we been able to really enforce a thorough blockage of the virus in the first few months, we might have been able to prevent it from mutating to the point where it's become this transmissible. But because it's changing, we can't make good estimates of what the odds are that a given infection with the current strain is going to lead to long COVID, and how that might vary depending on vaccination levels and, of course, which vaccine, because they luckily have gotten to the point where they're doing a certain amount of updating of the vaccine to keep up with the strains, but they're always behind because there's so much of it around, then it just mutates faster than they can get the vaccines ready.
So let's turn now to look at what states are doing, because there's been such a terrible job done in terms of public health education, and in terms of now states doing little or nothing to actually encourage measures to reduce infection, whether that be improving ventilation or encouraging people to wear masks in indoor spaces where there are lots of people, or just simply getting vaccinated. And then also, very little being done to reduce harm when people are infected in terms of the use of antiviral medication. So how do we explain, the way that states are, behaving in this context, the kinds of policies that are actually being implemented or not?
Okay, I assume by states you mean governments.
Yes.
Because particularly in the United States, that can be confusing.
Right. No, I'm talking about both, the elected, governmental institutions where there are capitalist democracies, and then also the associated state bureaucracies.
Yeah. I mean, listeners to this podcast presumably have a reasonable understanding that states are deeply tied in with capitalism. They are, in a real sense, capitalist states. And that goes, I would argue, for every government in the world today. Some people might argue about a few of those governments. For example, I have friends who might argue with me about Cuba. But regardless of that, a capitalist government is very much tied up in a lot of ways with the fortunes of capitalism. First of all, it sees success as keeping capitalism going and healthy. Constantly they pay attention to what they call the state of the capital of the economy, which is to say, how are profits coming in, and to a lesser extent, how are employment numbers holding up and stuff like that. In addition to that, they get their tax revenues because companies are doing well enough to pay workers enough so that they can tax the workers, or alternatively phrased, there's enough surplus value around which the states can tax, which ultimately comes out of the company sides, regardless of populist arguments about, it's only the poor who get taxed. I mean, there's wiggle room around that point. But in any case, they need the economy healthy, as they see it. Now, at the beginning of the pandemic, states all over the world instituted lockdowns, basically sent the economy into the biggest tailspin since at least the 1930s, and kept it going essentially by issuing cash, at least to governments that were economically and politically powerful enough to do it. Just basically issuing cash to keep the thing going. Like in the U.S., everyone got a $1,200 check and stuff like that. Now, why would they do that, given that they only care about capitalist health? And part of it is that capitalism depends on having healthy employees, workers, and other employees. And partly, capitalists are scared for their own hides and that of their families, as are government officials. So they did something that actually was intelligent and made good public health. But almost as soon as they did it, they came under intense pressure from businesses that were under pressure to keep their profits going, to reopen in various ways. Now, some of the companies made out like bandits in any case, like the groups that made their money by home delivery, Amazon, and then of course the computer companies, given that everyone had to use the various electronic modes of of communication during the pandemic. But that period ended. And basically the question comes, for a given economic system of a given country, at what point does the benefit of keeping workers uninfected and healthy get overridden by the need to keep profits going? Now, that's going to depend on things like the extent to which there's a surplus of labor around. In countries with real big surpluses of labor, you can reopen relatively easily. And the United States, for example, has a fairly sizable surplus of labor, so it started reopening in various times. And somewhere around the beginning of 2022, the United States switched wholeheartedly into the business of saying the pandemic is over. They had to do it slowly. They had to keep some credibility. If you want to go through other countries, China had a different set of calculations and a different set of political vulnerabilities, and it had, to some extent, dug a hole for itself because it had done a reasonably good job of preventing the virus from spreading by having really heavy lockdown policies. But at a certain point, on the one hand, a large number of workers began to revolt against some of the really incredible tightness of that, particularly when some of the more infectious strains got there. And so it quickly became politically infeasible for them to keep the lockdown. And they had at that point a fairly sizable spread of the virus and a lot of deaths, although the statistics on that are not really very trustworthy. I think that pretty much answers the question. I mean, to put it in crude terms, our health, human health, is secondary to the health of the capitalist economy. As Marx put it, accumulate, that is Moses and the prophets. Where prophets there, of course, is the world's biggest pun.
Yeah, I think it's what you say is very convincing. And maybe just to take it a little further, there's the question of, I guess, the extent to which governments have not promoted the use of, whether it's mask wearing or upgrading ventilation and some of these other kinds of things, and have presented it often as a kind of binary choice, right, between reopened or locked down, rather than considering a range of other kinds of options, right, non-pharmaceutical interventions of different kinds that could have been promoted in various ways to, reduce transmission. But I think it's just quite striking the extent to which, having kind of framed it in that way, the policies now have been pursued with every it does appear that there's just the intent of cultivating or creating an attitude that infection doesn't matter because it's politically difficult to deal with this, and there are of course all sorts of costs involved. Right? Who's going to pay for the upgrading of the ventilation in buildings, for example? Who's going to pay for the distribution of masks and the widespread distribution of antiviral medication and so on?
That's a tricky one. I mean, the ventilation is a clear issue of cost. Masks are cheap. There it's much more a question of politics. I am a Marxist. I'm not a populist. But what I mean by that is I don't think the governments have total control. I don't think the advertisers have total control over things. People have needs and conceptions and agency, in the fancy word that people use nowadays. And that's important for understanding the politics of COVID. I'm going to go back to really basic Marxism from when he was young, when he talked about the concept of species being. That is, what is it about being a human and how did humanity develop? And, all the analyses that anybody other than a sociobiologist ever does will tell you that humans developed as a social group of people, of animals. And, we became and began to develop more developed cultures and language and all that as a social process. Now, if you ever think about that, that means people like to be around each other, and being deprived of that is a cost. And people felt that during the early years of the pandemic. Now, that means that normal working people are suffering and want to reopen too, although they don't want to be the ones who die from the virus or get long COVID. But it provides the wherewithal for political demagogues to do all sorts of kinds of stuff. I mean, and once again, I don't know Canada well enough to talk to Canada, but the U.S., the right wing organized what called themselves mothers groups with signs like, "We want to see the children smile," and generally organized in a way that brought people's desire. The kids wanted to be playing with each other. So they were able to grab onto that reality and push it along, probably before it was safe to do it, at all safe, and take that and make it into a political battering line. At the same time, others were fighting over the issue of vaccine, including a certain section of what calls itself the left. And we're saying that, vaccines were dangerous and vaccines did no good, and they produced what they call data to support that. And the right wing, once again, got very much into that, along with their stuff about horse medicines and stuff. And they created a political context that made it look black and white. Made it, the concept of the other thing about it, which is fundamental to certainly neoliberal capitalism and original liberal capitalism, though maybe a little less so of Keynesian capitalism, is an extreme level of individualism. People are grown up saying, me, 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 me. I'm what counts. I have to protect myself. Maybe I have to protect my family, at least if they're not being too much of a pain in the butt. But I have to protect my family. But basically me. And the idea, although there's a certain thing coming out of our basic sociality, where we do like to help each other. People are extremely generous in many ways. And the early part of the pandemic showed it, with lots of forms of mutual aid, lots of forms of, helping each other and taking risks for each other. And, but even so, the basic ideology of the society is individualistic. So they're able to play upon that in all their politics. And public health messaging, by and large, has bought into the ideology that you appeal to people as individuals, and that's how you get them to change their health behaviors. I mean, this in the AIDS epidemic, that probably cost hundreds of thousands of lives globally. And what we have found in our various researches about AIDS, for example, was that people would often do things to protect others. And, often that was more important to them than protecting themselves. So that, it's just a misconception of public health. So all of that sets the stage for the absurd politics that developed around the pandemic, both when it looked like a heavy left-right fight in some countries, and now when it's become the center has basically given up and has said the pandemic is over. Now, when you do that, you have to then get people to go along with it. And people are thinking and talking with each other, human beings. And if you ask yourself, what are the difficulties for businesses? Even now they're having trouble getting people to come back to the workplaces who weren't in the workplaces, which means their mechanisms for controlling people and getting the most surplus value out of them is somewhat limited, which is why they're pushing people to come back to offices who can actually do the work virtually. They're trying to get electronic systems that can control that with some success. But apparently it's not as successful in a lot of cases, or else plus there are things that people do better and are more efficient employees if they're together. So that, there's a host of those things. And the way to do those things is to push the idea the pandemic is together. Now, there are contradictions in that, like everything. Like, I can't go to my workplace safely because to do so, I would have to get on a train. The trains are potential sources of virus transmission. And for various political reasons, they were unable to establish mask-only cars in this country. If everyone was wearing an N95, it would probably be modestly safe to stay on a train for 45 minutes. But they didn't do that, probably because ideologically they're having to push the idea the pandemic is low risk and not an important issue. I think that answers your question and probably overkill.
I think that's great, but it brings up the kind of related question in terms of how we understand not the actions of governments, but in terms of how ordinary people, making sense of all this, how the extent to which there's no longer really very much interest in understanding COVID-19 and understanding, the harm that it can cause and is still causing. And I think some of the things you said help explain this. But do you have any thoughts you'd like to offer in relation to that and the way that, people who often now would identify as COVID cautious are, quite a small minority?
I would say a couple things on that. One is when you've got a congruence between what people inherently want to do and government propaganda, it tends to be effective. Secondly, the pandemic has ameliorated. If you look at the death data, they're way down. And part of that may be because information systems have been degraded. In fact, I'm sure some of it is. But a lot of it is because between vaccinations and natural immunity and possibly the virus mutating to become a little less fatal, it's not as horrible a situation as it was. And that's often the case. The Spanish flu, as they call it, although, there's some evidence, my belief is that it really mutated to become seriously deadly in the area around the front lines in Europe during World War I. But pandemics do usually find a way of living with the species. The species may mutate a little in lots of time. The virus or whatever other infectious agent can mutate more rapidly. And although there are some pressures to become more of a problem, which is what happened with the Spanish flu in the front lines of World War I, and probably happened with HIV during the 1960s and 1970s, COVID may be adjusting somewhat to become a little less fatal, a little less immediately acute. And so it really may be a waning of the pandemic in that sense. So that's part of the calculation they make when they say we can reopen. And people are very happy to buy into that. Now, there's another strain to what you were implicit in what I think you were saying, which is one of the other things that's been noted about COVID is what people call anti-science. And, people talked about that with HIV before that. I think that goes to the social sources of irrationality and irrational thinking. Now, there are lots of them in the society. Think about racism. Racism is a belief that people with given skin characteristics are inferior in various ways. Now, there's no evidence whatsoever in various forms of research to support that belief, and plenty did not support it. But on the other hand, there is a visible correlation between being in a oppressed racial category and poor economic success, poor success in schools, and all the rest of it. Now, that's because of various forms of structural and processes of racism and exclusion, and doing the system doing its best to convince minority people that they're inferior, and their teachers at school that they shouldn't be expected to work to be as bright as the dominant race or whatever. And I'm talking here in general terms, partly because I'm very aware that this goes on, for example, in parts of Western China towards the Uyghurs, where the Han treat the Uyghurs the same way. And there are other places around the world with similar patterns. For example, Ukraine vis-a-vis Russia during the Russian Empire at various stages, with different degrees of horribleness to the degree of racism, of course. Now, what that comes down to is people conclude that the cause is the effect and the effect is the cause. That is, they're saying, the cause is racism, the effect is poor economic performance in what's supposed to be a meritocratic society where you get your just desserts. And so you just invert it and say, well, what's really the cause is the skin color. That's irrational thinking. And people learn that form of irrational thinking. Then there's things about the very workings of capitalist society that are irrational. Now, for people on the left, they've read Marx and Engels on religion. They've seen where they discuss how the economic chaos creates the need to believe in a supreme being or some other supreme force, which is fundamentally irrational. And they discuss it as fetishization and stuff like that. You can think of it in terms of, does rational thinking predict outcomes? It doesn't on the economics. People go to college thinking they're going to get ahead because they get lots of debt, at least in the United States, and then they get jobs at Starbucks or McDonald's because the other jobs for a lot of them just aren't there anymore. There's a lot of forms of irrationality in society. I thought at one stage that the web and all those kinds of software were going to be a real, kind of the last progressive thing capitalism ever did. And in some ways it is, but in other ways it's created great potentials for many forms of danger: super surveillance by the state, really well-targeted weapons which can be used against enemies in warfare, but also protesters at demonstrations in various ways. The possibilities of artificial intelligence where no one really knows what that's going to lead to. We just don't know. And of course, all the web creating an enormous demand for electricity, which in a capitalist society is met by creating greenhouse gases, which then are going to probably kill us all if we're not successful in getting rid of capitalism fairly soon. So in a system which is fundamentally contradictory, there's lots of reasons to believe in irrational things. Now, once again, capitalism weaponizes that. We saw it very visibly starting with the tobacco companies and their systematic erosion of belief in science by going after individual scientists, by attacking and saying, there's more, you have to look at two sides to that science and all this. That's been done with GMOs. It's been done with climate science. It's done with you name it. It's now part of the operational politics of big corporations. Anything they're told they don't want to hear, they pay people to pretend they're scientists. And they may have doctorates, but anyone can lie, including people with doctorates, maybe particularly people with doctorates. And they produce what they call science. They produce whole journals. They fund whole journals of fake science, essentially. So that too, all sorts of crappy things that pretend to be research get published in crappy journals, and then people who oppose vaccination quote it as if it were science. So I think that answers the question once again with overkill.
Maybe before we go on, we could jump back just a little bit and talk about how we got to the situation that we're in now. starting with what we know from current research about how the virus started to infect humans and then became transmitted between humans, and that it was kind of called origins and development of this pandemic.
Origins of the pandemic. And what I'm going to say speaks also to the possible origins of a bird flu pandemic if it comes to pass. It's already come to pass for other species, but not humans. Or AIDS. I mean, basically, we're in an age of emerging epidemics and pandemics. And it's due to capitalism as it's gotten into its later phases. In some ways, similar to what's happened with global warming, when they produce the diagram of public health, of the global temperature suddenly beginning to shoot up after around 1950. Capitalism has reached that stage increasingly during this same period where it's disrupting the natural habitats of various animals and plants and things, bringing, in a given area of a relatively uninhabited jungle or savanna area, there may be some tribal peoples who have lived there and have developed ways, essentially immunity to whatever is there, and where the virus or whatever pandemic we're talking about has never had the opportunity to become super virulent, super transmissible, because when it gets into a person, it just stops there, or it kills a tribe of 20 people and stops because there's no hosts around. What we're doing systematically is disrupting that. Businesses set up in what were previously woods, where there were various animals. Those animals move various places. The area I live in is overrun by deer. Those deer carry Lyme disease, for example. There's situations where people go hunting for marketing in the wilds. This is said to maybe be what happened in the case of COVID too. They bring back various what's called wet meat, but that just means live animals, which then get converted into meat by people to eat. And those things may have a virus, in this case, SARS-CoV-2. Now, of course, there are other interpretations of how SARS-CoV-2 came into existence around lab leaks. And of course, in the United States, at least, that's been seized upon by the right to attack the scientific establishment around, Fauci and NIH and all that. Reality is there's probably never going to be a scientific way to prove one or the other. I can create scenarios consistent with all the phylogenetic evidence I know of for either interpretation. There's a lot of evidence. I think the weight of evidence goes in favor of the wild development rather than the lab leak. But, that's always vulnerable to the fact that maybe that particular bat or whatever was brought into the lab and used for a source of virus and then leaked. You just can't tell. The more basic thing is most of the labs which exist in either as bioweapons development or bioweapons defense, the same labs, exist because of capitalist imperialism. If we get rid of capitalism, we get rid of both the capitalist push in terms of creating wilds into, or forcing deer into my neighborhood or whatever, and get rid of the need for bioweapons and biodefense development in those labs so that we can greatly reduce the risk of pandemics there. Now, what happens if you get a virus or a bacterium that's one of these nasty ones that can become pandemic? Well, capitalism has created a perfect mixture of realities to spread those things around quickly. People travel for business all the time, cross-continental, at the speed of something like 500 miles per hour. And unless it's something that kills you in an hour or two, you'll still be alive to walk off the airplane and infect other people. Even if you're not, the other people on the airplane will do that. People travel for tourism. People take, boats for cruises. We saw how that worked out in the early days of the COVID pandemic. Military personnel are constantly traveling between one base and another, particularly U.S. military personnel, because we've got the most bases. But then again, wars and so-called peacekeeping missions also spread potentially various things. There's been, over the last, I'm not sure, decade and a half, there's been a horrible cholera epidemic in Haiti. It was introduced into Haiti by a UN peacekeeping mission. And now, of course, that peacekeeping mission was designed to keep Haiti under the control of imperialism at a time when there was some fear that it might escape. So that capitalism creates enormous mechanisms for the rapid spread of viruses and other infectious agents. Now, there are two other ways in which capitalism is creating a nightmare. One of them is the way it organizes the production of meat for people to eat. It creates industrial farms, huge barns, think of them, full of nothing but chickens and cages right next to each other. Feedlots, often inside barns, but whatever, where you've got beef or pigs right next to each other. Makes it so that if one of them gets a respiratory infection, it's going to spread quickly. Rob Wallace makes the argument that, and it's got a certain degree of truth to it, that these things are read to be genetically as similar as they can, which means that, in nature, the variety of different immune systems in a given species makes it harder for a virus to spread among them. With these reduced variation herds of chickens or beef or whatever you want to think of, it spreads more rapidly. Now, there's another side to that, and for any given infectious agent, I'm sure the equations will work out differently in terms of whether it's protective or not. The variation in immune systems in, say, chickens also tends to mean that viruses may have trouble adapting in various ways. I mean, it's got an effect upon the mutation rate and directions that are hard to predict. And, I don't know how it's going to work out in a given case. But in any case, those forms of meat production have created huge risks. And for example, on flu strains, I read a book 4 or 5 years ago that had been written about 10 years ago, looking at the development of flu strains in China and talking about avian flu and how you've got migrating birds flying overhead of what are essentially herds of ducks being raised as meat. And the poop from the migrating birds infecting the ducks, who then become, and because when you have a species change, you can tend to be more likely to have mutations. And that it creates a situation where you're more likely to get a form of flu that can then get to the humans. So in any case, there's all sorts of dynamics around meat production. Another one has to do not so much with viruses as bacteria, and to a lesser extent viruses. But we have much better medicines against bacteria. So they're giving antibiotics to that growing meat, beef, chicken, you name it. And that tends to create mutant strains of various bacteria. They do that also to some extent a little carelessly with some things among human, which has helped create situations of extremely drug-resistant tuberculosis and chlamydia and clap, gonorrhea as well. So that we're also producing diseases we can't necessarily treat very well from diseases that we used to be able to treat very well.
Yeah, I think this is very helpful in terms of understanding the way that capitalism creates these conditions for pathogens to develop and to spread. But I guess that would brings us to a point which I think would be helpful to just focus in on briefly, and that is just to clarify for listeners how you understand what a pandemic is, because I think there's again some confusion out there about this. And having established how you understand that concept, how you would evaluate the COVID-19 pandemic.
Okay. Mike Haynes, a British socialist, and I had an interchange around that. He had read that basically, however you interpreted it, COVID had become endemic rather than epidemic. And basically, he didn't define the terms, but I think what he meant was it had adjusted reasonably closely to humans. Now, there's two problems with that. The normal definition of endemic rather than epidemic is that it's predictable. It's not. There's enough of the COVID around that we don't know where the strains are going with mutation. We keep hoping that it'll keep the way it's been, which is maybe a little more infectious, but also maybe a little less fatal and more control. No promises on that. It can go either way. So in that sense, it's not reliably endemic. The other thing he didn't mention is at what level is something endemic. Something can be endemic and killing 5 people a year in the United States, and something can be endemic and killing 50,000, like many flus have, or 200,000. I'm not sure what the current rate in the U.S. is. I think it's somewhere probably around 150,000. And those have very different meanings for people. In theory, it can be endemic and killing 5 million a year, at least until we run out of population. So that's the technical thing. The more socially meaningful thing is it does seem to be getting a little bit under control. And that's good. Now, the other thing I think we should probably talk about is health messaging.
I was going to ask you about that.
Yeah. Public health officials and agencies tend to believe that the way to convey health information is to stay on one message and be consistent. And I think COVID has shown that that's at best highly risky and can backfire on you. The fact is, when a new disease emerges, we don't really know anything about it. That's why it's new. We make our best guesses based on what we know about its viral nature from various lab studies and what we know about its epidemiologic nature by who's getting infected and who isn't and how rapidly. But they're guesses. And almost certainly some of those guesses are wrong. I saw it and lived through it to a certain extent with HIV, and I lived with it with SARS-CoV-2 virus, where initially it was a reasonable guess it would behave like flu, which is to say it'll take form in essentially coughed out spit, which will fall to the ground within a few feet. That's not how it transmits. It transmits much smaller droplets, which go all over large distances much more quickly, and the result is it spreads much more easily. And so that, whereas at the beginning saying you don't need to wear masks, just stay 6 feet away from each other, was not bad advice. It was mistaken advice. It was not evil. It was mistaken. Within a relatively short period, and before the messaging caught up with it, evidence began to become visible that indeed it was spreading in aerosols. And the problem there was that what the normal workings of capitalism had created a nightmare. There just weren't enough masks around, even for medical personnel. People had to strike around questions of getting PPE, personal protective equipment, namely masks and other equipment. Where they couldn't strike, they dealt with it by dying, unfortunately, or at least getting very sick and doing their best to protect each other. They should have been more open about all of that from the beginning. What I call the current, and if been public, and with a good friend of mine on the platform once, she had been guilty of this around certain aspects of how HIV is transmitted. I said, public health should not follow a Stalinist mass line approach to public education. It's false. You have to educate people enough to know the uncertainties and the principles behind what's going on. And then as science develops, you keep them up to date. And that way you both keep credibility and you're not lying. You're not lying. You're not telling people falsities. It's not deliberate by and large, so it's not lying. But it's easy to spread falsities when you don't know what's going on. So the other thing about public health, which we haven't really talked about, it's got to be based to a large extent on the people, not just as individuals, but collectively protecting each other. And if the people know enough, they'll work out ways to do it that public health experts don't know enough about how people interact to do well. We saw that, for example, with AIDS. Public health experts didn't know enough about gay communities or the communities of people who use drugs to know how they were already protecting themselves in better ways sometimes than the public health people were telling them to do. And the result was they lost a certain credibility. And they were also sometimes telling people suboptimal ways to protect themselves.
Yes, and I think that there are lots of ways in which what you just said is illuminating in terms of the failures of public health agencies through this pandemic. Which brings us to questions looking forward, given where we're now at with COVID-19, about what you would say in terms of what socialists and other radicals should be doing now, as we go about our work in unions and in groups based outside the workplace and in our everyday lives more broadly. What would you, like to suggest to people?
Yeah, it's a little bit contradictory, like all issues of reform and revolution. For unions, obviously, and some of them are doing this already, fight for protections against the spread of the virus, but also when people are sick, fight for protections for them. People with long COVID are disabled, fight for them the way you do for other disabled people. Fight for disabled people if you're not, which unfortunately is the case for a lot of unions. And there's a concept of employers have to make adjustments for the workers when the workers are disabled. Now, do it in ways that protect the individual worker who's disabled and protect the other workers. And that means, for example, there may have to be masking requirements in certain cases. It means, during a nurse's strike near me, I ran into one nurse who really just cursed me out practically for saying people should be wearing masks inside the hospital. I mean, totally. She said she understood about, coronavirus is like the cold. You don't need masks. She was wrong. And the other nurses knew it. There's lots of, if a union has to be for all the workers, so you have to confront those kinds of disagreements. The need for people who get disabled on the job obviously includes people who get infected on the job, as well as people getting infected to and from the job if they're taking subways or buses or something. And you have to be able to fight for that. More generally, some of us are trying to write an article on the question of what are some of the intermediate steps, and we haven't really come to firm conclusions yet. So I'm not going to try to lay too much of it down. The problem is because of the lack of concern around COVID, it becomes very hard for revolutionary socialists to form connections with union officials or rank and file activists. I used to be in a group called People's CDC, and we tried to do that with only limited success. Back in early 2022, we had more success. But after that, as the propaganda became more effective, it became harder and harder to protect against. And, we may be about to go through the same stuff with bird flu. I hope not. There is a chance it'll go either way. The most basic reality is revolutionary socialists and other workers have to become revolutionary socialists. We have to end capitalism. Capitalism is producing global warming. Capitalism is producing increasing pressure for there to be pandemics and for them to be bad pandemics. Now, in both cases, there are reforms that can mitigate that. For example, setting up early warning systems around pandemics, making sure hospitals have plenty of different forms of PPE, making sure everyone has well-purified water, and various other stuff like that, keeping track of infectious agents in the food chain. All that is part of it. Just like for climate change, you can, reduce various forms of greenhouse gas emissions through various kinds of fix-ups. None of it's sufficient. It just slows down the problem and maybe gives us time to get rid of capitalism. But, essentially at a certain point, this becomes equivalent to the question of what should revolutionary socialists do to get rid of capitalism and to replace it with something different. The other thing is activities to end imperialism also tend to reduce health threats to the extent they're successful. I have written articles and other people have written articles about the health effects of Russian imperialism's attack on Ukraine. There is a Jewish Voice for Peace Health Advisory Committee that puts out weekly reports on the horror shows in Gaza and the West Bank being done by Israeli imperialism. There's totally inadequate coverage of this in regards to the Chinese imperialist mistreatment of the Uyghurs and the Tibetans and various other groups. Similarly for the Kurds and, the Rohingya, you could go around the world. And the other thing, of course, is that any war of any kind involves situations where people developed weakened immune systems, where people are moving across continents, potentially carrying pathogens, so that, the reduction of military conflict is also part of the, as well as it is around global warming, because the amount of greenhouse gases emitted in the course of a war are atrocious.
Sam, thank you for this. I think you've given us a real sense of the extent to which the interconnectedness of health, pandemic disease, capitalism is so profound that we really can't discuss any one of those things without talking about the way in which it's interconnected with the others. So thanks for this.
You're welcome.
That's it for this episode of Victor's Children. I'd like to thank Jonathan Croker, the producer of Victor's Children, without whom the podcast wouldn't be possible. I'd also like to thank Posey Legg, who designed the graphic for Victor's Children. If you found the episode worth listening to, please do tell other people about the show, since word-of-mouth recommendations are especially helpful. If you don't subscribe through your preferred podcast app, please do. And while you're there, please give the show a high rating. It helps to promote us. If you have a suggestion for an episode or some other kind of constructive feedback, feel free to be in touch with me. You can contact me through victorschildren@gmail.com.